Even asymptomatic people carry the coronavirus in high amounts. To view the full article, click the first link in the description below. Of all the coronavirus qualities, perhaps the most surprising has been that seemingly healthy people can spread it to others. This trait has made the virus difficult to contain and continues to challenge efforts to identify and isolate infected people. Most of the evidence for asymptomatic spread has been based on observation. A person without symptoms nevertheless sickened others, or elimination. People became ill but could not be connected to anyone with symptoms. A new study in South Korea, published Thursday in JAMA Internal Medicine, offers more definitive proof that people without symptoms carry just as much virus in their nose, throat and lungs as those with symptoms, and for almost as long. It's important data, that's for sure, said Benjamin Cowling, an epidemiologist at the University of Hong Kong who was not involved in the work. And it does confirm what we've suspected for a long time, that asymptomatic cases can transmit infection. Discussions about asymptomatic spread have been dogged by confusion about people who are pre-symptomatic, meaning they eventually become visibly ill, versus the truly asymptomatic, who appear healthy throughout the course of their infection. The new study is among the first to clearly distinguish between these two groups. There's been this big question pretty much since January, since data started coming out of China, about people that were asymptomatic or pre-symptomatic, said Jason Kindrachuk, a virologist at the University of Manitoba who was not involved in the work. What we haven't really had any clue of yet is what role people who are asymptomatic play in transmission of disease. The new study measured the virus genetic material in the patients. The researchers did not follow the chain of transmission or grow the virus, which might have more directly confirmed active infections. Still, experts said the results strongly suggest that asymptomatic of all the coronavirus qualities, perhaps the most surprising has been that seemingly healthy people can spread it to others. This trait has made the virus difficult to contain and continues to challenge efforts to identify and isolate infected people. To view the full article, click the first link in the description below.